Now, the issue of unavailability or shortage of personal protective equipment for frontline health personnel continues to be a matter of concern in Ghana, despite the numerous donations in cash and PPEs to government, hospitals and COVID management facilities. Today, community health nurses whose members are those affected by the problem have taken their destiny into their own hands. They're mobilizing funds to procure PPEs and other logistics for their members who are part of government enhanced surveillance and contact tracing team. Some of them were presented with hand sanitizers. It is the first of many items that the Community Health Nurses Association is procuring to support its members. Esther Banfo is here in the studio with me. She's president of the association. I'm going to find out from her first how working as a community health nurse has changed for you in the wake of COVID-19. You're welcome.
Thank you, my dear.
Right. So tell us, how has life changed?
Thank you. My regards to my people, their life has changed because we are not in the normal times. Now, fear is grasping everybody at the facility there. Because we used to meet a lot of clients, but we're so free, mingle with them, laugh with them, go closer, to the extent at times even hugging them. But now, it is world apart. The one you knew yesterday, laughing with, talking with, at times eating with, today has become somebody else. You don't know who you are approaching now. So things have turned in a different dimension for us.
Things have turned in a different direction. But one of the things that you need to be able to do your work as usual and not fear for your own self is PPEs.
Yeah.
What is the issue there, again, from your own words?
Thank you very much. You know, my people, basically, we are the grassroots. Talk of the CHIPS compound, the health centers, and then to the hospitals, even though we are everywhere. And now this COVID-19 issue deals with, do I say hygiene per se? So we need the hand washing, we're doing it though. But talk of the situation we find ourselves, we need gloves. The gun thermometer, hand sanitizers, the nose mask. For we, I think we are okay with that because since we are not at the treatment center, we don't need the gowns, whatever. But if we should get it, fine. But all these things are not there for my people to use. And the worry aspect of it is that now the disease is becoming a community spread. So it's a source of worry. My people are living in the community with the people. If anything at all, they will go to them before they are referred to the higher place. So before the person will leave the facility, whether the CHIPS compound, health center, or whatever, what happens there? So my people are at risk. They will leave there, go to their homes. They don't know what they are carrying to their houses. They'll go and meet with their family. And they pose a threat also to their family because their family too are exposed. So these PPEs are not there for my people to use. I remember, I think when things started, I think because we are preventive nurses and our motto is prevention is our business. So all the time we put things down because most of the times we foresee unforeseen circumstances. So we always prepare ourselves in terms of prevention. That kept some people to have this sort of nose masks and maybe sanitizer. It even became a national agenda. So if I understand you, when this thing happened, I mean, because you are more preventive conscious, your members started buying some of these PPEs themselves. Exactly. Okay. Exactly. And like the one we are using, we are not supposed to even use it for the whole day. Maybe when you close, it's disposable. Yeah. But because we are not having them, some will have to tend to wash them, iron them, and continue using, because you cannot even get to buy.
Ironing these, are they ironing, washing and ironing these ones?
Some people do because you don't have it.
It's going to tear apart if you put it in water.
It depends on the way you do it, not soaking it in the water. Yesterday I did one. Some are of good quality.
Okay.
Yet.
So how did you do it?
You just put it, you soak the, you put omo or maybe a soapy water. You dip it into it. You just shake it for some few minutes. And then you rinse it. You won't squeeze it. Then you pick it and then you rinse it. And then you dry it and then you iron it and you are there.
Really?
Yes.
So that's how some of your members are treating
some
face masks, so they can reuse them.
Yes, but now, you know, we have resorted to the local ones. Some seamstresses are sewing them at the community level and that. So that is what we have now resorted to.
Well, what I'm learning also is that you've decided to raise funds by yourself to procure these PPEs. Tell us about this drive.
Thank you very much. I think as leaders, we should always, and our members' welfare is a hallmark. If they are well fed, we also have our peace to operate. So I think we're thinking they'll be supplied with these PPEs. So we're waiting, promises were coming here and there. But we saw that it was all to no avail. So we decided, we pay dues as members. So we decided that if the money is sitting down, there is a proverb that says that you won't leave a club for the dog to bite you. So if we are having something small in our coffers, do we let the money sit down for our people to suffer before we go and take the money to go and treat them? And even the treatment, the chances are 50-50. So why don't we go in our coffers? It's their own money, our own money, and then help them out of it, at least to do some prevention. We need them alive to continue for us to work with them as members.
So you're using your welfare money to buy
it's our own use money that we used. Yes.
Okay, but you're also appealing to anybody who wants to support.
Exactly, philanthropists.
Okay, how can people support?
We have a national office here. We can leave our numbers.
Yes, please do.
And we can also write to them.
Okay.
020 78 80 707
707
024
024
63 84 964.
964.
Yes, please.
And people can get in touch with you and help you to get PPEs for
please.
your members. So your members are mainly, this is a national association, right?
Yes, please.
So your members are mainly all over the country?
All over the country, every corner.
In remote parts of the
remotest, country. Not even the remote, the remotest. Where you go, there is a hamlet, 1 or 2 people living there. You get community health nurse attending to those people there. So we are everywhere, as well as we rise even to the tertiary hospitals.
Okay, and you're looking to write to people, organizations that are willing to support. We have, this segment is for people like you, people who work with sick people or people who have to assess sick people. For us, those are our frontline workers. Anybody who's working with coronavirus patients, anybody that's out there working close to anything that exposes you to the virus is this segment is for you, essentially. So we're here and we'll be engaging you more as we go along, hopefully to help with the donation drive that you're looking to go on. But they're asking for you to help them. If you're at home, you're a business entity, you're an organization that wants to help, these are their numbers: 020-7880-707. That's 020-7880-707. You can also reach them on 0246384964. That's 0246384964. These are community health workers who don't have PPEs. They're having to wash and reuse something like what I'm wearing, which is supposed to be disposable, to protect themselves, which is obviously no good. You want to reach out to them, support them. Do you have any final words as we wrap up,
Yes,
Ms.
I want to make a plea. I think to the Ministry of Health, Ghana Health Service, and the government as a whole, I think it is time the nation will have, or it's a must, have a proper healthcare system that will be able to respond to national emergencies. Because I think when this thing started, if there were to be such a unit, I think they would have foresaw what will come, so that they'll get themselves prepared. And then these PPEs and what have you wouldn't have been a problem. So I'm appealing to the government to, I think, look at that one too. And then there again, there are a lot of health institutions. I think they should also inculcate in the programs or the curricula emergency preparedness and response in public health, in the training institutions, and then at the university level. So that when things of this nature happens, it will go a long way to help our mother Ghana.
Thank you very much, Ms. Banfo, for coming through. Like I said, every now and then we can be engaging you and some of your health workers who are the nurses who are in the remote parts of the country to talk to them for their experiences. We share their experiences on the ground and how they're doing as well. I've been talking to Esther Banfo. Esther is the president of the Association of Community Health Nurses. The Association of
Right. Community Health Nurses Association
Community
Ghana.
Health Nurses Association Ghana.
Yes,
Thank you for that. Community Health Nurses Association of Ghana.
Yes.
You want to reach out to them, help them. They need PPEs, and they're also calling on governments to help them with some of the PPEs that have been received through donations. Thank you very much for coming. Well, that has been your front line for today.